Good afternoon. I'm Katie Wingert. I'm the Marketing Director at Broadlawns Medical Center. Thanks for tuning in to today's KCCI Great Pro Chat. I'm here with Dr. Udaya Kabadi from the Endocrinology Clinic at Broadlawns, and we're going to take some questions from viewers, but first we're going to get to know Dr. Kabadi and let him tell us a little bit about the conditions that he treats at Broadlawns.
Thank you, Katie. Good afternoon to everybody out there as well.
For starters, can you tell us a little bit about the types of conditions that you treat within the endocrinology clinic at Broadlawns?
Endocrinology means the disorders of the glands that secrete their hormones into the bloodstream directly. So it's the diseases of the endocrine glands. The commonest disease of the endocrine gland is diabetes, because pancreas has some endocrine tissue. And then we talk about thyroid gland, pituitary gland, parathyroid gland. So it's primarily a disease that involves endocrinology or endocrine glands.
So can you tell us a little bit more? What is diabetes?
Originally, actually diabetes comes the word from Latin, and diabetes means excessive urination during the day. Now we have two kinds of diabetes. One is called diabetes mellitus, and the other one is called diabetes insipidus. Now what is mellitus? The meaning of the word mellitus is honey. That means people are putting too much honey into the urine. That means sugar in the urine. Originally the diagnosis of diabetes was made not by blood testing, but by literally urine tasting. Physicians used to taste the urine of the patients, and it was sweet. And that's how the diabetes was diagnosed. The other way it was diagnosed was urine was left in front of the ants, and they used to crawl on the urine, so there is sugar in the urine. That's how the diagnosis was made. Now we have come a long way. We now do blood tests. Absolutely not much urine testing for diagnosis at all. The other kind of diabetes is diabetes insipidus. Now what is insipidus? Insipidus is simple word in English, is insipid. That means it's very dilute urine. That's very uncommon. Diabetes mellitus is very common. In fact, today we have almost 30 million diabetics in this country. And we have another 80 million who we call pre-diabetes. That means they are non-diabetics, but they are not normal, in between. Some people will call it borderline diabetes. So today, diabetes mellitus or diabetes is almost like a tsunami. It's rising exponentially in epidemic proportions, not only just in US, all over the world. We have 350 million diabetics today in the world. And obviously out of that about 30 million in this country. We are the third country in the world. First is China, India, and then we come here. So yes, very high prevalence of diabetes in this country. And the reason for type 2 diabetes, which is actually in obesity. As the obesity has risen in this country, also the type 2 diabetes, which is rising in epidemic proportions.
So if someone found out that they had elevated blood sugar levels, what are things that they can do to preclude them from actually developing type 2 diabetes?
This is exactly what I was talking about. This is what we call pre-diabetes. And the diagnosis of pre-diabetes and diabetes, simplistically, if I can tell you, fasting blood sugar, anything below 100 is normal after an overnight fast. 100 to 125 is what we call as pre-diabetes, and then 126 and higher, that's what we call diabetes. Now, how can we prevent pre-diabetes or even a normal person to become diabetic? First is, there are some populations where it is more prevalent. If you have strong family history, if you are overweight or obese, if you had diabetes during pregnancy, if you have high blood pressure, particular way of lipid or fat pattern, people can become diabetics. So how can you prevent it? Surely the most important part is a lifestyle change. I know habits die hard, but if we reduce people gaining weight, if you reduce the obesity prevalence, then we can prevent diabetes. And individually, sure, diet, exercise on a regular basis, appropriate diet, appropriate exercise. What is appropriate? 30 minutes a day for at least 5 days of the week with your heart rate probably 1.5 times what your resting heart rate is. If we do those things, I think we'll prevent diabetes in the country quite a bit. But unfortunately, that has become difficult, and we are now using medications to prevent diabetes type 2 as well. But as long as you take the medication, the progress is less. But if you stop medication, things will revert back again as they would happen. So yes, we can prevent type 2 diabetes, but we got to work hard at it. Type 1 diabetes in a way is not preventable because it's initially viral infection affecting the pancreas cells, and then those cells produce some kind of a substance and destroy those cells themselves. So insulin is lacking, and that's very difficult to prevent. We have tried harder and harder and harder. And in fact, I have a question which is asking me that there is some study going on in Boston. They are giving some immunosuppressive therapy in mice who trying to prevent type 1 diabetes. And I always tell people, first and foremost, humans are not mice. So don't always think what happens in mice will also be true for humans. We don't have any studies so far that have been done to see if we can prevent type 1 diabetes. Thank you.
So another question that we have is, what are symptoms that patients might experience if they have elevated blood sugar levels?
Once the blood sugar rises above about 180 milligrams, then we start pushing it out into the urine. Because renal threshold is about 180. That means if the sugar is rising, you are going to get too much urination. Remember I said earlier, diabetes mellitus, too much honey in the urine, and sugar cannot go out by itself. It has to go out with water. So people have too much urination, frequent urination during the night, and that can lead to sometimes infections. Urinary tract infection in men and even genital infections, both in men and women. So that's not uncommon at all. And then obviously when you are peeing a lot of urine, you are going to get dehydrated. So you have symptoms of dehydration, maybe dizziness, maybe weight loss, maybe fatigue, maybe tiredness. Those are the kinds of things that you need to watch for. But predominantly, if you have any time, 3-4 times waking up during the night to urinate, I think you must talk to your doctor to get checked for diabetes.
Okay. You were recently the keynote speaker at a global forum on diabetes. I know it's a growing concern here in the US. Why do you think it's becoming more of a global epidemic?
The reason is because I always tell when I go out in the other countries such as India, Pakistan, I am from India originally, and unfortunately I always say that everything that is exported from Western countries is not necessarily good. There are many good things, but we have exported the fast food, the McDonald's. I can tell you one very simple thing. In 1958, there were only about 3% of the population here was diabetes. Today we have 9 to 10%. Mississippi, 12%. Why? 58, what thing happened that changed all these problems? This pattern. Multiple things. One was McDonald's opens its door. Fast food. 2, people started watching too much TV, black and white. Beginning of couch potato syndrome. 1960s, it got expanded, black and white became color. More fast food chains came out, further expansion of couch potato syndrome. And ultimately in the 90s, you will be surprised to know, today, the common type of diabetes today in children is not type 1 anymore, it's type 2. 42% of children with diabetes have type 2. So it's becoming increasing proportions, and the reason now because obviously kids drink soda, a lot of fast food, and what exercise they get? Fingers do the talking and fingers do the walking. Rest of the body does not get much exercise. So more and more sedentary lifestyle, food changes, and that have become a problem in terms of obesity and then also type 2 diabetes.
Okay. What are some other types of endocrine-related conditions that you treat?
I think the second commonest condition that we treat in endocrinology is thyroid problems. Thyroid problems such as thyroid underfunctioning of the thyroid, or over-functioning of the thyroid gland, and sometimes maybe a nodule in the thyroid, cancer in the thyroid. So that's the second endocrine organ disorder that we see. And more recently, obviously in postmenopausal women, we see a lot of so-called osteoporosis, that means brittling of bones. In fact, we do recommend, at least I do, that every woman, once she gets menopausal, she should have a bone test, because something we can prevent. We don't have to worry about treatment, but at least we can prevent further progression if it is there, or actually prevent from normal bones to brittle bones. We can do that. So that's becoming very common as well. And there are other organs that we take care of, such as I talked about menopause, we take care of men who have problems, maybe sexual function, calcium problems, and so on and so forth.
Okay. I know that you are an adjunct faculty member for University of Iowa, and research is a large part of what you do as well. If someone wanted to participate in one of your research studies, how would they get involved?
I think presently at Broadlawns we have established a research unit. We have a staff, and presently we are doing 3 studies right now with type 2 diabetes. Type 2 diabetes is so prevalent, so that's the first love that we have, and we take care of a lot of patients. So that's the research that we are ongoing. If anybody out there needs to participate in this research, I think they should call us at Broadlawns at 282-3041, and our receptionist at the clinic will take care of it. Then obviously we have to decide whether you are eligible or not based on your history that we can obtain on the phone. One of my coordinators can do that, or I can do that. And once we decide that you are eligible, then we bring you in, get you to be screened, and decide which one of the 3 studies, based on your medications, based on your insulin, and based on your blood glucose monitoring, that we can put you in one of these studies. So we have 3 studies ongoing. We may get a couple more, and maybe we'll have some of our own studies that we will be doing. So yes, if you have any interest, and yes, we provide you for your transportation to a certain degree. Now if you are coming from Chicago, no, I can't provide you for air travel, but I can provide you if you are coming from Des Moines or suburbs or even Iowa, anywhere. I think we can provide you for your transportation. For a car, gas or something like that, we can do that. So yes, if you are interested, please give us a call, either myself or Nancy, who is our coordinator, Sarah is our coordinator, and Lindsay is our receptionist. And the telephone number is, if you are outside the area code, call 515-282-3041. And I think we will distinctly have a conversation with you and decide whether you will be eligible to participate in any one of these studies. And we'll be glad to do that, because it not only helps you, but it also helps the other diabetics in that way as well. And what we have ongoing is not really any experimental drug. The drugs that we are using are already approved by the FDA. So that's a concern that you should not have.
Okay, we're going to take time to do a couple questions from the viewers. The first question is, I'm interested in doing a keto diet. I'm currently on 100 units of Lantus 2 times a day and 80 of Humalog on a sliding scale 3 times a day. Is this something I can do, and how would I need to adjust my units?
The first thing I would recommend is not to do keto diet, because one of the complications of diabetes actually is ketosis. And when you say keto diet, that's a high-fat diet, so you get ketones. And usually, yeah, you may lose a little weight, because when you get ketones in the blood, you also get nausea and sometimes vomiting, so you may not eat as much. But having ketone in the blood too much, it's not good for your health. So I wouldn't recommend that. Prudent diet is what I would suggest for all diabetics. Obviously, with that being diabetic, sugar has to be avoided, plain sugar, because the blood sugar rises very quickly when you eat sugar, because it starts absorbing from the tongue itself. In fact, if somebody gets low sugar spell with diabetes, what we do? We put some glucose gel or sugar gel on their tongue so that it can be absorbed right away. So that's one needs to be avoided. But other things, depending on, I presume you are taking so much insulin, you must be type 2 diabetic, and I think we may be able to alter management in this area because when you use that much insulin, any dieting is difficult, because when you are using so much rapid acting insulin, you actually feel hungry. And when you feel hungry, obviously you eat to avoid low sugar spells, you gain weight, and as you gain weight, now that insulin that you are taking is not enough anymore, because your insulin does not work very well. I presume you are in an overweight category or maybe higher weight category. That's why you're needing that much amount of insulin. But I think we could turn it around differently. I think there is a good possibility with the medications that we have today. We may not need to give you that quick acting insulin with the meals. We may need to give you still the long acting insulin, but we might use some other medications and avoid that quick acting insulin, so that your efforts at losing weight actually will help you more.
Okay, we'll try and fit in a couple more. We have a grandmother that has a grandchild with type 1 diabetes. Are there any snacks that you would recommend?
First and foremost, I must tell you that I am an adult endocrinologist. I can take care of maybe children in teenage group or maybe 10, 12, but 2-year-old, probably I don't take care of that young kids with diabetes, which is probably type 1. However, I can always tell you very simplistically, as I told earlier, the best thing to avoid is free sugar. So yes, your type 1 diabetic could have sugar-free candy, sugar-free snack without any problem. Complex carbohydrate is fine. Simple carbohydrate is what we need to avoid. So free sugar needs to be added, such as soda, maybe too much orange juice sweetened, another juice part sweetened, candies that have a lot of sugar. I think those things need to be avoided. But you can always use sugar-free or artificial sugar, including those kind of substances, as snack.
Okay.
But you will be better off asking somebody who is a child's diabetes specialist, and yes, we have that access in Des Moines as well, in Blank's Children's Hospital, where you can be taken care of as the child with type 1 or type 2 diabetes. I don't do it because I am primarily an adult endocrinologist.
Okay. The last question that I have is someone who has an enlarged thyroid and they've developed nodules. Is there something that can be done to make those nodules go away?
Again, I think nodules, depending on the size of the nodule, if there are less than 1 centimeter nodule, we usually leave them alone, because the cancer possibility in that nodule is very, very, very remote, and you can't biopsy those nodules with that size. Only way we can find out if there is a cancer there in that regard is by taking the whole gland out, which I would not recommend. Also, it depends on how big are they. Also depends on how big your thyroid gland is. Is it causing trouble for swallowing, maybe choking sensation, change in voice? Then we need to definitely do something about it quickly. But we cannot get rid of the nodules by a medication per se. Thyroid hormone giving from outside will shrink your gland, but it will shrink the gland that is functioning. The nodules probably will not go away. If we cannot give you a kind of a radiation treatment, because the dose of radiation would be extremely high, even by radioactive iodine treatment, and I don't think that would be feasible. So if the nodules are causing the problems, such as maybe over-functioning nodule causing overactive thyroid gland, we can treat you with a medication and maybe radiation. If it's a multinodular gland with non-functioning, and if it's not causing local problems such as difficulty swallowing, choking, then I probably would have to leave it alone. If those are the problems, only way we can get rid of it is by doing surgery.
Okay. Well, we are out of time for our webcast today, but if there are people who have other questions about diabetes or endocrine-related conditions, they don't need a referral to come see you.
They don't need a referral to come to see us. They can call the Broadlawns clinic at, I think it's, you can call 282-2200 and ask them for an endocrinology clinic, or use that extension 3041, and I think we can get you to be in the clinic. They will inquire about your insurance situation and whatnot, but I'm pretty sure we can get you there. Secondly, I will also tell you, I get calls from sometimes people outside, either at the Broadlawns or sometimes occasionally even a direct some reason on my cell phone, and I could answer the question you have on the phone as best as I can, but I can't tell you 100% on the phone. We always like to talk to you, have a conversation with you, and need to see you. I will always make it very clear. I do not take care of the disease. I take care of the person who has the disease. I don't take care of diabetes. I care of a person who has diabetes. And that's my basic principle. We have to treat each other as human beings and not as things. And that's what I personally, frankly, firmly believe in that concept. So if you come to see me, in fact, I had a patient today. She comes to see me for overactive thyroid. And she told me she was having some problem with her tongue. And I looked at the tongue. I don't think it looks that great. I actually referred her to ENT, ear, nose, throat clinic to be seen on Monday because I am concerned she has been a smoker for many years and I am concerned that this may actually be a cancer of the tongue. So I'm not going to see you just for your diabetes. I'm going to see you as a person. If you have diabetes, sure, we'll take care of you as you are diabetic. And yes, diabetes is a chronic disease. And when I take care of the chronic disease, it's a team concept, diabetes educator, which we have, dietitian, which we have. If we need a social worker, we have, psychologist, we have. It's a team concept. But remember, you are the captain of the team. You got to be the prime mover in your care. I can do as much talk as I want. You got to walk the walk. If we don't work together, I don't think we are going to be successful in taking care of your diabetes. But if you help me help you, I am almost 100% sure we'll get you where we want to go. I always tell my patients, I'm not going to drive your car. I will direct you how to go and where to go, but not drive you. You have to do it yourself. You got to take care of yourself. You got to be accountable for what you do. I will guide you, but we have to work as a team. Thank you very much again for questions as well as letting me have this opportunity to talk to you all. If you have any further questions, you could, as I said earlier, get hold of one of my team at the Broadlawns Medical Center. Thank you so much.
Thank you.